Okay, we are going to start on the math unit today. So, you guys can actually take out your math book, the one that looks like this. I think you guys should have already been assigned one. So, anyways, you guys can take out your book. We are going to be using this over the next few weeks. Kind of what I want this chapter to look like, because it's going to last, I think we've got 3 or 4 weeks of the math chapter. This will just look, basically we'll go through chapters within this, we're going to go through pretty much the whole rest of this book. So we'll get through that, and every time that for every chapter that we go through, I want you guys to actually do the post test at the end of every chapter. So that will be your assignment that goes along with this. Now, you'll also have to keep up with the assignments that are on Pass Assured. And so you need to just make sure that you go to Pass Assured, as we go through different things. Just if you will go to that particular unit after we get done with this chapter in the book, and make sure that you do that unit, listen to them, and, do the subsection quizzes as normal. Now, some of them you guys will probably want to go ahead and do. Some that we won't get to. I think there's some that we've, are kind of like old stuff. I think there may be a Roman numeral one on there. There may not. It may just be that other one. But anyways, I haven't looked at it in the last few days. But we'll go through here. We are actually going to start with chapter 6, and then we'll go back to chapter 5, and then we'll move on from there. I wanted to start at chapter 6 just to kind of give us an intro into looking at prescriptions, reading prescriptions, figuring out pharmacy math, because a lot of what we're going to do from here on out, we're going to be looking at orders and how to fill those as far as the math part goes. And so I want us to do that, start with that first. So we will actually be on page 147. Just know that Friday of this week, and I do want you guys to, I know normally I don't make your assignments due until like when we have the test, but as far as the math stuff goes, I want you guys to just have everything turned in by Friday. So like today after we finish chapter 6, go ahead and work on the post test. And then, and actually for chapter 6, if you guys will just do the odd numbers on the post test, that's sufficient. So just the odd numbers on here for chapter 6. And so we'll do that. But I do want you guys to turn whatever we do for the week, I want it to be turned in on Friday. Unless, of course, we have a lesson on Friday and then it'll be due the following Friday. But just because if you guys get too behind with the math papers, it is pretty much impossible to catch back up. So we'll start here. We're going to start with chapter 6, and we'll get going. So interpretation of medication labels and disorders. It's on page 147 in your math calculations book. Let's look at the keywords first. So auxiliary label, it says this is a label added to the prescriptions to provide supplementary instructions. So anything that, anything that you're going to add instructions to kind of the label that you make as the tech, or that you put on, like the sticker that you put on your prescription. A diluent, this is an agent that dilutes a substance. In pharmacology, it's a liquid added to powder. So if you've got like a vial and you add, normal saline to it or something, that normal saline in that instance would be the diluent. Or like for amoxicillin, if you take oral amoxicillin, like a suspension, it actually comes in the bottles that you would usually get it. It's like that pink bubblegum medicine. And it comes in those bottles, but it actually comes in powder. And then you add the water to it. So the water in that case would be the diluent. So the dosage or the dose strength, this is the weight of medication in a dose. And you'll see that come back around. Excuse me. The generic name. So this is kind of, the generic name is how you'll find the medication within like the drug formulary and stuff. So that's the one that you'll see. Usually the generic name is a lowercase letter. Some medications are only generic, so they won't have a brand name, and you'll only see the generic. But indication, this is the reason to prescribe a medicine. So anytime you see that on anything, an indication, and you know that it's been on your med list for the last 9 weeks, 10 weeks. So inscription, this is the part of the prescription that indicates the name of the drug, the quantity, and the dosage prescribed. And we'll actually talk more about that in a little bit. A medication order, this is a written or verbal directions for administration of medication within the healthcare setting. National Drug Code, NDC numbers, we learned about those the very first week of Pass Assured, if you'll remember. This is a unique number that's on a drug product label that identifies the manufacturer. Actually, no, we didn't do it the first week. We did this whenever we, I think we may have done this at the beginning of the med chapter, but anyway, we've looked at NDC numbers before. Anyways, a number on the drug product label that identifies the manufacturer, the product, and then the size of the container that it comes in. Pharmacokinetics, the process of drugs and movement, how they move in the body, if they're absorbed, distributed. So we've talked about that before. Pharmacotherapeutics, the effects of the drugs in the treatment of conditions, so how they function, how they work, how they treat the disease or illness. A prescription, written order by a licensed healthcare professional for dispensing or administering medications. Polvule, it's kind of hard to say. This is a capsule filled with medication in powdered form. Reconstitution, the process of adding a diluent such as water, saline to a powdered or crystallized form of a drug. So reconstituting is just adding like liquid to a powdered drug to make it the drug, or make it the strength of the bottle that it should be. That's reconstitution. That's all it is. Whenever you hear that word, and we'll learn about this as we go. But anyway, scheduled medications, of course, you guys know what those are, the ones that have potential for abuse. A SIGNA or a SIG, this is part of a prescription indicating how a medication is to be taken or applied. One of the things I want you guys to do within the next week or two, preferably this week, is there is a study aid on Pass Assured that says SIGs. I would like for you guys to go in and do that after we finish this unit. Okay, so go in and practice that. Make sure you practice it, and then you go back and take the test version of that. Remember that all of those study aids on Pass Assured, you have to practice with them and then take the test. You have to get all of that done before it will allow you to take the test at the end of the semester. So a SIG, it says, is part of the prescription indicating how a medication is to be taken or applied. So basically it's like the recipe or the instructions. Superscription, this is part of the prescription that's designated with the symbol RX. And so you'll see that, RX, whatever. Toxicology, the study of adverse toxic reactions or toxic levels of a chemical or drug. We've talked about that before. And then the trade or the brand name. This is a name given to a medication by the manufacturer. It's usually a capital letter, like Tylenol, for example. Tylenol is a brand name or a trade name versus acetaminophen, which is the generic name for the same medication. Okay, you guys don't have to worry about the pretest here. Let's move on over to page 155. We're going to go over a few things on here. The top of page 155, it says medications are ordered by a physician either as a medication order in a patient medical record or on a written prescription for the patient to take to a pharmacy for dispensing. So the two types basically of two ways medications are ordered is medication order. That's often used in like a hospital or a nursing home, somewhere that's inpatient. And a prescription is like the piece of paper that you get from your doctor and take to the pharmacy for them to fill. Now, a prescription, a lot of times they're not written out by hand anymore. A lot of times you'll see them written on a piece of paper and the doctor just signs in, or it's electronically signed. So that can be the case as well. Skip on down that second paragraph there. It says, just as a reminder, because many drugs have similar sounding or look-alike names, reading the prescription can become much like working a puzzle. If an order should be questioned in any way, the pharmacy technician should bring this to the attention of the pharmacist. Okay, you'll see questions like that on here. You know, you're not sure you can read this. What should you do? Do you fill it anyway? Do you ask the pharmacist? It's always ask the pharmacist. It says the pharmacist is ultimately responsible for dispensing the medication. Even though you may be the one handling it, ultimately the pharmacist is still, you're responsible too for your own actions, but the pharmacist is also responsible for your actions. And so, you know, that's something that comes with the job. But it is like working a puzzle, and you'll see why in a few minutes. Okay, so look on down underneath what does a prescription indicate. On that second paragraph, it says Figure 6.1 provides short descriptions of the parts of a prescription. The 5 major components are a superscription, inscription, sig, subscription, and then the signature of the healthcare professional. So we're going to go back and forth for a second. Because line A of this figure is the pre-printed name of the physician or group of physicians, and you guys can see that it has their address and all of that info. Okay, it says part B includes the patient's name, address, date of prescription, and the patient's age if they're a child. So you can see that it's got their name, their address, age. It should, well, no, I won't say should, but a lot of times it might have the date of birth as well. It says line B indicates the patient's name. Oh, I'm sorry, I already did that. Dating the prescription is important because prescriptions must be filled within 12 months of writing, except with controlled substances or scheduled medications. So we've talked about those before. But for the most part, your prescriptions, anything that's not scheduled has to be filled within the year, or they're not going to take the prescription any longer, and you shouldn't take the prescription any longer. It says, and the refilling of prescriptions is dependent on the date. Okay, so whether someone can refill something or not depends on the date as well. Maybe they may not be able to refill it for another 4 weeks. You can't necessarily get all their medicine at the same time. Okay, it says line C is the superscription, or the symbol RX, meaning recipe or take thou from Latin. The inscription, which specifies the name of the medication. So like in this case, it's Amoxil. Specifies the name of the medication, its strength and quantity to be dispensed. So look, Amoxil, 250 milligrams. That's how many milligrams is in a capsule. Number 30. That means they need to dispense 30 capsules of Amoxil, 250 milligrams. 30 capsules. Okay, so that's why that number is there. It's just number 30. That's how many pills they're going to get. If the medication must be compounded or prepared, the ingredients would appear in this location. So if it needs to be prepared, you know, one part, well, one time I had a doctor who wrote a prescription. I had to mix some medicine for my daughter's eczema. So, it wasn't really eczema, it was a different dermatitis. But anyway, so it was 1 part, 0.1% hydrocortisone to 1 part Aquaphor, mix them, and that I created a new ointment basically for her skin. So that's where you would see that. It says line E is the SIG or Cigna, giving directions for actually taking the medication. So look, SIG is 1 capsule TID, remember, which is 3 times a day, times 10 days. So 3 times a day for 10 days. 3 times 10 is 30. That's how they got the number of the medication. Okay, so 3 times a day for 10 days. Okay, it says the subscription line F tells the pharmacist the drug form as well as how the medication is to be taken. So, again, the form, we know it's a capsule, so unless it's otherwise noted, we can assume that capsules and tablets are PO, unless it says something different, then it needs to be taken a different way. Okay, so capsule gives us our route of administration. All right, the physician's signature appears on line G, and then the number of allowed refills on line H. This one would have no refills because it's an antibiotic. Finally, if the prescription is for a controlled medication, the physician must place their DEA number on beside their signature. So they would have to put a DEA number on there. Okay. Now on page 156, I'm reading from the bottom. Prescriptions may be written or verbal, unless it's a Schedule II med. It has to be written and signed. But the legal implications are the same for both. It doesn't change anything if it's verbal or written. Now, typically with verbal orders, the doctor has to go back. Like if I'm a nurse and I take a verbal order, I'll write it down. I will repeat it back to them, and then I will, depending on where I'm working or whatever, the doctor will still need to sign that medication or that prescription or order. Just make sure, and you guys will not be taking orders over the phone. That's a pharmacist job. So if somebody says, I'll need to give you an order, then you need to find the pharmacist. Okay. So let's look at this. Practice problem A on page 157. This is where you guys will really be using your abbreviations that we've learned. Okay, so now I always have trouble with people answering these. The way I would like for you guys to answer this is on prescription interpretation. I would just want you guys to write out what it is. You don't have to write out numbers, but I want you to write out your abbreviations. You don't have to write out milligrams or anything like that. So you'd put, atorvastatin, 10 milligrams, 30 tablets, 1 tablet by mouth every night at bedtime. And then on the label instructions, what I want you guys to write is what would you put on the patient label. Okay, I'm not going to put, now not every night at bedtime. I mean, you just need to make sure it's simple, what you write on the patient's prescription, but it needs to be very, very clear so that they don't take their medication incorrectly. So on theirs, I would just put atorvastatin 10 milligrams, take 1 tablet every, at bedtime. 1 tablet daily at bedtime. Okay. Or 1 tablet every night. There you go. The label instructions will probably be a little shorter than your interpretation. Your interpretation is just you as a pharmacy tech, how you're going to read what they wrote down. Label instructions is what you're going to put on the patient's label. So that's how you'll answer these whenever you get to the post-test as well. So let's look at number 2 on page 158. Interpretation, so hydrocodone / APAP, which if you'll remember is acetaminophen. 5 and 500. That 5 and 500, what that means is that there's 5 milligrams of hydrocodone for every 500 milligrams of acetaminophen. So 5 milligrams hydrocodone and 500 milligrams of acetaminophen. Number 20, okay, so I'm going to write down hydrocodone / acetaminophen 500. That gives us our dosage. It's a combo drug. Dispense 20. Okay, you can write it that way. And then I'm going to put 1 to 2 tablets by mouth every 6 to 8 hours as needed for pain. Remember, PRN means as needed. So PRN, pain, as needed for pain. Notice their DEA number is on here too, because we know that hydrocodone is a scheduled drug. So the label instructions, if I'm writing this out for a patient, I'm just going to take 1-2 tabs, by mouth every 6 to 8 hours as needed for pain. I'd pretty much write out the sig I guess, in words. Sometimes it's a little different. Number 3, prescription interpretation. Premarin, 0.625 milligrams, dispense 30, 1 tablet by mouth daily, at same hour. Some of that's going to repeat. Label instructions, if I'm going to write this for the patient. 1 tablet by mouth every day at the same time. Okay, that's how I'd write that out. Number 4 here, Zoloft 50 milligrams, dispense 30, 1 tablet by mouth every day with breakfast, with the morning meal. So on their instructions, on the patient's instructions, I just put 1 tablet by mouth every morning with breakfast. Okay, it just needs to be something simple that they're not going to get confused. Let's look at the next one because this one's a little bit more complicated. Prednisone, okay, is a steroid, and steroids always have to be tapered off. You don't want to just stop a steroid all of a sudden, like take 5 pills a day and then just quit taking them. You always, especially oral steroids, and you have steroids, you have to be tapered off of them. So notice it says prednisone 10 milligrams. That means in every tablet there's 10 milligrams, and they want them to dispense 40 tablets. So I'm going to write down prednisone 10 milligrams, dispense 40. Now look at the instructions. 1 tablet by mouth 4 times a day for 4 days, times 4 days. D is for days. 1 tablet by mouth 3 times a day, times 4 days. 1 tablet by mouth twice a day, times 4 days. And 1 tablet by mouth every day for 4 days. Okay, so these are going to look the same. And if they look exactly the same, I'm okay with you writing same on label instruction, but don't put too much info because they don't necessarily need to know that you've got 40 tablets or whatever. But that one, I would explain it. I'd say take 1 tablet 4 times a day for 4 days, then take 1 tablet 3 times a day for 4 days, then take 1 tablet twice a day for 4 days, then take 1 tablet. You can write it out like that. Excuse me. Okay, let's skip on over. Look at page 164. Okay, medication order is a method of providing the same information as found on a prescription, but this is usually used in the inpatient or it can be used in a physician's office too, like if they're going to go ahead and give you a shot, like an antibiotic shot or something along those lines. There's an exception with the medication order is that the order is written for either the number of doses or for the specific length of time for a medicine to be taken. With the medication order, the healthcare professional is told what drug or drugs should be administered, the strength, frequency, and the frequency. And specifically, it's going to have the time. So look at this next one. This order is a means of providing drugs at correct frequency in inpatient setting. It's harder because you have different people administering drugs all the time. So since the medication order has 6 parts here, the date, the patient name, their medication name, the dose or medication, the strength or form, the route, definitely, the time, the specific time, not just every morning, okay? And then the frequency of administration, so how often. So let's look over here at these physician orders, and you can see some, actually, you know what, I'm missing something. And the signature of the physician or whoever's ordering it. It says medication orders may be verbally communicated, but everything has to be transcribed into written form and then signed by the physician always. Okay, so let's look at this on page 165 is where I am. Look at this part A. It says this is a patient's medication administration record. It's called a MAR. So this is the order that the doctor wrote. So on starting January 12, 2007 at 9 a.m., see that military time, 0900, here's the medications that they're supposed to get. Lasix 80 milligrams by mouth twice a day, BIDs twice a day. digoxin 0.25 milligrams by mouth every day, and then slow K, which is potassium, 10 milliequivalents by mouth twice a day. Notice there, we've got our Lasix and our potassium. Hey, if you didn't see that potassium, you'd be like, okay, I want to check on that. Then the physician's signature. Okay, so then you go down here, down to Part B, and this is actually what their MAR would really look like, that you would sign and date and say, yes, you've given this medication. So it's got the date of the original order on here. You got Lasix, 80 milligrams by mouth, twice a day. So look, it's scheduled at 9 and 9, 12 hours apart, 9 a.m. and 9 p.m. And look how they've initialed every time that they've given those medications. Now, digoxin, 0.125 milligrams per dose by mouth every day. So that means they just need it once a day. And look, it's scheduled at 9. So somebody initialed that they've given it. And then the slow K is twice a day. So 9 a.m. and 9 p.m. I would not want to take that Lasix at 9 p.m. But anyway. Okay, so the same schedule as the Lasix. And so that's how that is done. I do want you to notice on 166, there's a little blue box that says Tech Alert. These are really good to read, and I would really suggest that you read these as you go through this book, and we will too. Anyways, it says for patient safety, and even though an allied health care professional has interpreted a medication order, the pharmacy tech still has the responsibility to check the order for any inconsistencies. So even though it's been through other hands, it's still important that if you notice something that's not right, that you talk to someone, check with the pharmacist, and make sure. Okay. All right, skip on over to 168. This is about a medication label. It says, what does a medication label indicate? It says, the label on the medication bottle is the identification of the drug within the container. So what we're talking about here is like whenever you get, the drugs that you keep at the pharmacy. Okay, so we've got the generic name again, lowercase letter. This is the name that it's given in the formulary when the FDA accepts it. Okay, lowercase letter. The trade name or the brand name again is a capital letter, and it's assigned. The name is assigned by the manufacturer. Registered trade or brand names are usually marked with the copyright R circle. It's not really copyright, that's a C, but anyway, it's registered. It's a registered trademark. Okay, the NDC number, which we already talked about, manufacturer, product, and then size of the container that's coming in. The dosage strength should be on the label, or the amount of active ingredient that's found in the medication per the dosage form. How much is found in the container. And look, the total quantity of medication is packed by the manufacturer. So how much do they get in, as a whole. The dosage form of the medication, that should be on the label, how you use it. The name of the company manufacturing it, special instructions for mixing or compounding if it's supposed to be on there. Storage requirements because of environmental factors. So a lot of them are, say, refrigerate, and you'll see that. Okay, and then look, it says lot and batch numbers or control number of the medication that can be used for identification if the medication is recalled. Controlled substances are indicated by a large C with the schedule number in Roman numerals within the C on these labels. Okay, look at the tech alert at the bottom of page 169. It says always read medication labels at least 3 times before you fill up the prescription. Read it before you remove it from storage, so whenever you take it down, before you actually start counting out the pills, and then again before you put the medication back on the stock. Make sure you read it again. Okay, let's look at some examples of some questions that you'll see. Okay, so number 1 on page 170 says the manufacturer, and you guys can see that at the bottom, that Bristol Myers Squibb is the manufacturer here. The NDC number is at the very top where it says NDC, 0003 515405. The trade name is usually in either in all caps or it's going to be capitalized. So Pravachol, and look, it has a little R beside it. Pravachol is the trade name, and Pravastatin sodium is the generic name. The dosage strength is indicated on this label, the strength of the medication. Okay, notice it says 10 milligrams. Okay, that's going to be our dosage strength. So that means it's 10 milligrams per tablet is what they're saying. Okay, before any medication has been dispensed, how many tablets are in the container? If you'll look in that little bitty writing, kind of in the middle little section of that, and on the left, there's 90 tablets. Okay, skip on over on page 172 to number 5. Let's look at this one. It's a little bit longer. Okay, it says, who is the manufacturer of this medication? Okay, look, Standard Products, Ladiri Products, whatever. The NDC number, again, is at the top, the 0005370665. Storage is an important factor for palatability. What directions need to be given? You'll read on here, store in refrigerator to preserve the taste until it's dispensed. Refrigeration is not required as long as they use it within 14 days. Okay? So refrigerator is what they're saying to make it taste better. What directions need to be followed in preparing the medication for dispensing? So if you go up here, if it's got anything, it just says shake well before using the storage. That's all it really says. What are the storage directions and why are these necessary? Store in a refrigerator until it's dispensed. What are the storage? What is the trade name for this medication? So the trade name is erythromycin. The generic name is the ethyl succinate. I'm not sure if I'm saying that correctly. The form of this medication, look, it's a suspension. Remember, that means that you've got larger particles of powder in a liquid, suspended in a liquid. The total volume of medication available, it's going to tell you. Look, it says 1 pint in the bottom left-hand corner, 473 milliliters. That's how much is in here. The dosage strength of this medication. So look, here's the strength, 200 milligrams per 5 milliliters. Now, whenever you see a liquid medicine, that's how you're going to see it. It's going to have your milligrams or micrograms or whatever your unit of measurement is over the milliliters. So for here, it's 200 milligrams in every 5 milliliters. So you could put that as your dosage strength. Okay, this medication has a time limit for storage at room temperature prior to a decrease in its effectiveness. I don't really see that. Well, I mean, there is for the patient. It says, to basically not use it after 14 days. And I guess that's it on that one. Okay. So that's how you look at those. Skip on over to 175, and we are getting there. It says using units and milliequivalents as measurements for dosage. Okay, some medications such as penicillin, heparin, and insulin, as well as others, used less often, such as hormones, vitamins, and antitoxins, are measured in units. A unit is a standard of measurement that's set according to a laboratory standard when a biologically based medication contains some product of either plant or animal origin. It says these may include USP units or international units. No universal value to a unit is applicable because the value of a unit is measured by the physiological effect a drug has on the body. The effect of a drug varies from medication to medication, so the equivalent given on the label is the guide to the amount of medication that is to be administered to a person, but they don't, it's a guide. So I do want to go over a few of these with you. A few things to know. So what they're basically saying is that within these different medications that are come in units, there's different concentrations of units per milliliter. So there's no, there's no like go between or whatever. Anyway, so let's see, 176 says insulin, which is also in units, requires an insulin syringe. So insulin have insulin syringes that are already ready to go with the right ratio, I guess. So that's a little bit different. But everything else is actually going to be ordered in the same way. Milliequivalences are used to measure electrolytes that are used as medications like potassium, chloride, etc. So you got these two, but the problem with the units outside of insulin, for the most part, is that everything's different. So penicillin has a different amount of units, in a milliliter than something else might have. So that's why they're made that way. The last paragraph on 176 says, when using units or milliequivalents, conversions are not necessary because the order will always be written in the dosage amount that matches the label strength of the medication. Insulin is always ordered in units, potassium is always ordered in milliequivalents, etc. That's how you order them. So let's look at these practice problems. Number 1, total dosage of the medication in the vial. Okay, look at the bottom left-hand corner. It says 20 milliliter single dose vial. That means it's got 20 milliliters. So if we look at that, look at the strength. It's 2 milliequivalents in every milliliter. So 40 milliequivalents is the dosage of the medication in the vial. That's how we know. Who manufactures? The manufacturer is LifoMed. It's written at the bottom. The metric amount of the medication is 20 milliliters. And the dosage form, look, it says injection. Right under potassium chloride, it says injection. So that's what clues you in as to what it is. Okay, look at number 2 down here. The dosage of the medication in units. We've got 20 million units. Okay, so penicillin comes in with lots of units. It says this medication is to be administered by what route? So look, this is injection, and sometimes it tells you exactly if you can or can't, like use it IV or, but it doesn't say that, anything like that. What is the trade name? That's the Pfizer pen or whatever. The generic name is the penicillin G potassium. It's right underneath that. The usual daily dose of the medication. Let's see what this says. Usual dose, 6 to 40 million units daily by IV only. So this is only IV. How many milliliters of diluent should be added for the medication to have approximately 1 million units per milliliter? So right now we've got 20 million units per milliliter. Oh wait, no, I'm sorry. Look, how many milliliters should be added? Usually if you have to dilute it and there's specific instructions, it will give those to you on the bottle. So if you turn your book kind of sideways, it tells you how much diluent to add for every unit per milliliter of solution. So look, if I want to make a million, like it just said, there's 11.5 milliliters you need to put into this bottle to make it that strong. Okay. Let's look at one more, number 3, because this one's insulin. Okay, it says who manufactures this? Lilly U100. Okay, this means that, where is that written on here? Oh, the U100 in the bottom right-hand corner. That means that there's 100 units in every milliliter. That's how this functions too. Most insulin syringes are in that. What's the total volume of medication in the container? 10 milliliters. You can see it at the top. And then what does R mean on the label? Humulin R stands for regular, which is a type of insulin that you're going to get. So it's a fast-acting insulin. Okay. And I think that is it. Again, 181 is where your assignments start. So just only worry about doing the odd ones. That way you don't get bogged down. Some of them take a little while to write out. So just do the odd on page 181. And you guys are good to go. Now you know how to read a prescription. So I hope you guys, as you get prescriptions or see someone else and see theirs, I think you'll find it that you have learned a ton and you'll know how to read it. So you guys have a wonderful day.